blackboard, I didn't really fill in over here, but, here would be your cerebellum, here's your pons, here's your medulla oblongata, and as you come down here, it's the spinal cord. Understand? Okay? So, we label them as you go from front towards the back. Now, I'm not going to ask you to identify the 12 cranial nerves on the brain. I'm not. But I will ask you to identify 1 and 2 on the brain because they're so prominent. And you actually have nice pictures of this. I don't know. Just look through there it is, okay? Here. This is called the olfactory for cranial nerve number 1, the olfactory nerve.
You know that one.
This is called the olfactory bulb, and this is called the olfactory tract. So this is cranial nerve number 1, bringing what into the brain, folks?
Smell.
Smell. If you remember, smell, here, this one's better. Okay, comes in your nose and goes up here. Remember in the cribriform plate, the olfactory foramen. Okay, if I sit this back in here, this cribriform plate and the olfactory foramen is coming right towards this nerve. Okay, that's what the picture is kind of trying. I have a picture there trying to show you that. I don't know. Let me see. Okay, so olfactory nerve is cranial nerve number 1. Yeah, but I have another picture, I think. Here, okay, that kind of demonstrates this idea of what the on the top here, what the olfactory nerve is doing from the olfactory foramen and the cribriform plate. Okay, and then I'm actually glad, what happened to the pituitary gland, though? We don't want to lose that. Okay, that the pituitary fell because when you then look at the brain, if the pituitary is there, it blocks this, and there's your X that I've taught you in the past. What? Cranial nerve number 2, the optic, there's your X of the optic chiasma. Everybody remember the X? So your right eye is seeing the left side of the room, so to speak. They cross over, remember that?
Oh, yeah.
There's your, see the X? Here, maybe this way, I don't know. There's your X. See it? Okay, there's your optic chiasma. I expect you to recognize these 2 on the brain because they're so prominent. So the olfactory, the bulb, and the tract, cranial nerve number 1, and the optic chiasma of cranial nerve number 2. And you've been taught this.
Which part is the bulb and which part is the tract?
The bulb is the beginning.
Okay, and then the rest of it's the
This is
tract.
the tract.
Okay, thank you.
Okay? All right? Okay, all right. And that's where we're going to use the brain. Okay?